We are now going to discuss what data to prepare before doing data into Helix WinNet. This is mainly three types of data. A list of the wards that will participate in the PPS. The first column is the code of the ward that you yourself assign. It's basically the abbreviation that you use to name this ward in your hospital, such as for instance ICU1 or ICU2. The second column has the full name of the ward that you yourself in the hospital use. And the third column is the code for the ward that the codebook gives to this type of unit. When 80% or more of the beds belong to a certain specialty, then the whole ward is counted to that specialty. If it's less than 80%, it should be noted as a mixed ward. A fourth column would be useful, which would be the day that you will be doing data collection on this specific ward. The next type of form is hospital data, Form H. The first field, hospital code, deserves some attention. Normally you would be filling in the NSIASH code. However, because this data needs to be anonymous, we will not be using the NSIASH code. You will instead be using a new type of code, Third Trusted Party code, which is the TTP code. Every site of every Belgian hospital will receive its own TTP code. If a hospital is only one site, then it's very easy. The TTP code will be filled in on Form H, and that is the only type of TTP code that will be used. If you are a merger hospital, all your different sites will receive their own TTP code. They will usually be following numbers: 223, 24, and 25. We advise you to do data collection and data entry per site because this will give the most interesting feedback. However, if you truly prefer to do so, you could also do data entry on the merger level. In other words, you would get a percentage of HAI per merger and not per site. If this is what you wish to do, then as the hospital code, you will fill in the several TTP codes that you have, one behind the other. If this is your hospital code, that means that you are doing data entry for site 223 and 224 and 225 all together. In other words, the specific TTP codes put together without any spaces. If only these two are doing data entry together and this one is doing data entry separately, then you will fill in two hospital data forms, one for 223, 224, and one with the hospital code 225. As you can see, in our case, we are doing data entry for a site because the hospital code is only 3 digits. The first day that data was collected was the 8th of August, and the last day that data was collected was the 20th of August in our site. Data entry is not taken into account here. Next, you will give the number of beds for your hospital. These are not exact numbers, but rounded numbers. The hospital size, total number of beds, should be rounded up to the nearest 25. 476 becomes 500, but 499 also becomes 500. Number of acute care beds, again the same system, rounding up to the nearest 25. 401 becomes 425, but 426 becomes 450. The last, being number of ICU beds, is rounded up but to the nearest 5. 6 beds become 10, 11, 15, and 16 beds become 20. Next you will fill in if you've excluded any wards. Some wards should be excluded, and the PPS protocol clearly describes this. For instance, chronic wards should be excluded. However, you may also choose to exclude certain wards, although this is certainly not the intention of the PPS. However, if you've excluded some wards that should be excluded, or you've excluded some ward that should not be excluded, in both cases you will mark yes, and then specify the names of the wards that you excluded. If you have not excluded any wards, then simply mark no. Next, you will fill in the number of beds in the included wards. This is an exact number. This is not a rounded number. Next, you will fill in the number of patients included in the PBS. This, of course, will only be known after completing data entry. The last variable on this side of the form is hospital type, primary, secondary, or tertiary. The protocol gives you some guideline as to which type of hospital is which, but we understand that for the Belgium situation this is not very easy. Many hospitals will have the feeling that they fall in between two of these categories. In that case, please simply choose the most appropriate one, and certainly do not choose two. The right side of the form is mainly about characteristics of your hospital. These are data that are not going to be available for 2011 and will be chosen for a year previously, for instance 2009, or 2010, or 2008. We had in our example hospital 10,000 admissions in 2009, 30,000 patient days, 700 liters of alcohol rub, 250 patient rooms, of which 50 are single patient rooms. It may look to you as if these are also rounded numbers, but this is certainly not the case. The last two variables are the full-time equivalents of infection control staff. The reason that we talk about these separately is to remind you that in Helix WinNet you cannot use points for decimals. You will need to use commas for decimals. 2.5 becomes 2,5, 1.8 should be 1,8. In the last column you can fill in whether these data apply to the entire hospital or only to the included wards. The fact that we've chosen to do some for the total and the last two for the included wards is merely a coincidence. It is not a best practice. Finally, we will mark if the data apply to a single site or to a hospital trust or merger. In our case, it's already fairly easy. There are 3 digits in the hospital code, therefore this is a single site. That means either it was a hospital of one site or a merger hospital that chose to do information per site. If you are a merger hospital and you've chosen to do data entry on the merger level, in other words, you will have an HAI percentage only for the entire merger and not per site, then you will mark here Trust Merger. In that case, you will also have a hospital code that is longer than 3 digits, for instance 6 or 9 or perhaps even 12. Finally, you can mark whether you use the standard or light protocol. In Belgium, we will actually only be using the standard protocol, but internationally the ECDC gives a choice between the light protocol and the standard protocol. During the pilot, however, it was shown that the Belgian hospitals that participated with a light version and with a standard version took as much time per bed during data collection. Data entry was a little bit easier for the light version, however this did not compensate for the fact that the feedback of the light version is far less interesting. This is mainly because the risk factors in the full version are given per patient, and in the light version they are only given per ward. On one of the next forms you will see that the risk factors are mainly catheters in place, surgery since admission, and the McCabe score. The last field, comments and observations, should not be used. In the current version of Helix WinNet, we cannot guarantee that what you would write here would actually get to us. Therefore, we advise you to contact us by telephone or send an email, although we prefer telephone.